Hi, and welcome to Queen City Skin Podcast. This is your host, Dr. Elizabeth Roston. As a board-certified dermatologist, I am a skin, nail, and hair specialist, and I have developed an expertise in cosmetic dermatology and aesthetic procedures. This is your place to learn about skincare, skin conditions, and the latest cosmetic techniques and services. Empower yourself with skincare and anti-aging knowledge for healthier, more beautiful skin and appearance. However, the information in this podcast is not for medical advice. It is for informational purposes only. You should always consult with your doctor for your best care. Hi, and welcome to Queen City Skin Podcast. Today I thought we'd talk about leg veins because now is the season to come in and get your leg veins treated. The leg veins that I treat, the treatments that I offer here at Charlotte Skin and Laser, are for the superficial veins, but today we'll cover kind of all the veins, including the ones that I refer out for, because all of these are covered kind of in a consultation if you come in. So visible leg veins do become more common with age, and they're not always just a cosmetic concern. Issues with leg veins can range from little small broken blood vessels near the surface, the little spider veins. They're very common. See them all the time, and people come in like, I want to have these treated. They're considered unsightly to many patients. They just don't like them. But you can also see very large dilated and bulging veins called varicosities or varicose veins. So broad spectrum of things that we see for leg veins. And again, the things I treat here are mostly in the spider veins and some larger veins. Varicose veins I tend to send out. But vein issues can lead to health problems in the legs. It can be more than just cosmetic. You can have occasional or chronic swelling, pain, and skin issues. This is probably why we see a lot of people with veins, because in the lower leg, if you have a vein issue, we can start to see some discoloration, reds and browns, rash. It's called venous stasis dermatosis. Poor wound healing, and even ulcers. So if you have a poor wound healing, it can lead to an ulcer. You can even get deep vein clots, known as deep vein thrombosis or DVT. So for this reason, if somebody I'm seeing, even if it's a gentleman who hasn't asked me about his veins, and I see any of these changes, I look at them and see what might be needed and encourage a referral to a vein specialist to improve the health of his veins, because it can lead to rash and poor wound healing and ulcers and blood clot. Okay, but mostly what we're treating here, and probably why you guys are tuning in, is spider veins, red, purple, visible blood vessels just under the skin. They really can show up in many different areas of the skin, and they are just cosmetic concern. You're not at danger or anything. However, they can be a sign of worsening vein disease that can progress with time. So what causes these things? Well, the varicose veins really is a valve dysfunction. And if you come in for a consultation, if it's just spider veins, I usually don't get into the valves, but I do look for signs of valve dysfunction. But weakening and dysfunction of the valves in our leg veins can start the process of all this venous disease. So our leg veins, these are the veins deep in our legs. You can't see them. Okay, you can see the spider veins, but you can't see those veins deep underneath. If I want to look at them clinically, I got to send you out for an ultrasound. Okay, but they have those veins down deep. They have valves in them that keep the blood flowing via gravity back towards our feet, right? How come all our blood doesn't pool at our feet? It's because of these valves. It pushes the blood back up to our core and our heart, and the muscle pushes that blood back up, and then the veins are like a backstop that keep it from flowing back down. But when these veins separate with age or distension of the vein, they're not going to work. They're not meeting. It's like a dam that's not working, and the blood flows back towards our feet, and then you get pooling of the blood with distended veins and swelling in our feet and ankle. And this is what can lead to signs of venous insufficiency, which includes pain in your lower leg, or pain when you push on your inside lower leg, or just kind of feeling heavy, achy. Your leg's achy at the end of the day might be a sign that you have some poor venous flow, swelling in the lower leg. And then that color change we talked about earlier, that all can be a sign, as can itching and rash in the lower leg. So that can all be a sign of it. So it can start with the valves. Risk factors for this include age, just good old-fashioned wear and tear, can lead to valve dysfunction. Sex, it's way more common in women. Okay, so hormones tend to relax vein walls. Pregnancy, in addition to the hormones of pregnancy, you get some vein pressure from the pregnancies and dilation of the veins, right? You're supporting one or more living being in you, and it takes an increased blood supply, so your veins get bigger. Family history plays a role, as well as being overweight, or if you're in a situation where you're sitting or standing for long periods of time. Okay, so movement helps veins. Movement, that muscle movement, pushes that blood flow back up where it's supposed to be. Sitting or standing without movement is a risk factor. Preventive measures include wearing a compression sock or hose for any high-risk activity, such as sitting at a desk all day, standing without moving around, airplane flights, long car rides. Pregnancy, great idea to wear a compression sock during pregnancies. And then, really we'd probably all benefit. It's just not all of us want to wear hose all the time. And they make these good looking. They make them for men that look like dress work socks. They're great. We have colored tights for women. You'll see that a lot of nurses wear them. They've gotten the message about it. Also, keep your weight normal. That does help. Exercise regularly. Move your legs or get up and walk around if you're sitting for a long period of time. Movement helps. And if you are sitting, elevate your legs. So how do we evaluate these? I already mentioned the ultrasound. So if I see one of these signs on you and we want to treat your veins and I see these signs, I will typically send you for an ultrasound to test the valves. It just looks for flow. It looks for that venous reflux. Venous reflux is when the blood flow goes back down refluxes back down towards the feet. Now, if you do have venous reflux, you might need a procedure where we close the vein from the inside. It's called endovenous, meaning the inside of the vein, ablation. Endovenous ablation. Ablation is heat sealing it, kind of just zipping it right up. Well, maybe like those food sealers at home, but that works on the inside instead of the outside. And don't worry, you've got plenty of veins. If they seal up that leaky one, your legs will actually be in a healthier situation. And I say I make referrals for this. I don't offer this treatment. So let's talk about what I do and what I see most patients for. Is treatment of the spider veins, or what's called a reticular vein, the bigger blue veins, but not the varicosities. Sclerotherapy is when we inject a sclerosing agent into the vein, and this sclerosing agent is irritating to the vein and causes destruction of the vein wall. Sounds great, but veins are dynamic, so a series of treatment is needed. Smaller veins are actually harder to treat, more resistant to treatment, because they're under higher pressure than the larger blue veins. Okay, it's kind of like if you're in a water gun fight, right? You want the water gun with a little tiny nozzle because you can really shoot a long way. You can get someone across the room versus the ones you pull back and it just blows a big thing of water. You'll get somebody more wet, but it's just not any pressure. The smaller veins have more pressure and they're more resistant to treatment. And then we do things to maximize your results, like wearing compression hose after. What do we inject? Common question. We inject the sclerosing agent, typically polydocanol. And polydocanol was originally investigated as an anesthetic agent. But it wasn't so good because it caused irritation of the skin and sclerosing of veins. But that means when I inject it in your veins, it doesn't sting or burn or hurt. Okay, now the needle hurts. We can talk about that. we inject, we typically use foam sclerotherapy, and that's where we mix the liquid with a little bit of air, and because it's a detergent type agent by chemical formula, it foams. And the foam is more effective because it sticks to the vein wall a little bit better. I also will use glycerin on occasion for little tiny veins or resistant veins. All right, is it painful? Well, a lot of needle sticks can be painful. It's a little tiny needle, but the injection agent itself is not painful. I don't really have this discussion anymore, but 15 or 20 years ago, people were terrified of sclerotherapy because when you use hypertonic saline, which is what a lot of people used back then, hopefully they're not using it anymore, but except for certain small areas, that hurt. A lot of stinging. It's not like that anymore. Okay, so if you had sclerotherapy with saline and thought it was awful, I can tell you with the polydocanol, it's not. Some of the side effects we see are immediate. Some swelling and itchy areas right after the injection. Almost looks like little mosquito bites, and they start to itch. It's actually a good sign. It means we've gotten in the vein, we've irritated the vein, and it's working. You'll have a little bruising, redness, some mild swelling. It'll be minimized by wearing the compression hose. You can also get these little tender, hard areas. This is where inside the vein it made a clot or a little inflammatory reaction. You can treat this with like a warm compress, ibuprofen. Sometimes you have to have you come in and we'll just nick the surface and drain that clot out, and that helps it heal more quickly. A rare side effect is a skin ulcer, and that is where probably some of the sclerosing agent leaks out into the skin, and it irritates the skin too much and compromises it, so later there's a little breakdown of the skin and an ulcer. So most of our leg veins we're going to treat with sclerotherapy. What about lasers, right? You're thinking, oh my God, I'm needle phobic, I want to do a laser. Laser treatments are a little more challenging. If you're treating a larger vein with a laser, I can tell you it can really hurt because you're heating something larger under the skin, and that just really hurts. And also the safety factor isn't there with a big vein, so I tend not to do that. That can be kind of risky. Also with a laser treatment, if you've got a vein, and let's just visualize it. Let's visualize we're going down to eastern North Carolina. We're getting near the coast, and if you look at a map, you see where all these little creeks and rivers run off the big river, right? Well, just visualize that as your vein. So now we're at the beach, and I'm injecting one of the little creeks, but I'm able to get my injecting agent. It just goes all the way up and into the mini creeks and up into the river. It just flows. So I've just treated a one county area on your leg veins with one or two little needle sticks. If I did that with a laser, that would be like 80 pulses with the laser, and that kind of hurts. So a laser hits a small area. It can be helpful for little tiny veins that I just can't get a needle into, or I just don't think is working real well, or sometimes we use it in conjunction with sclerotherapy. But for us, it's not a primary treatment option. And really, I should say, it's not just for us. I mean, it's for practitioners that carefully take care of leg veins. Laser treatment is not a primary treatment for leg veins. People use it if they're not trained in sclerotherapy, but really sclerotherapy is the answer. So that's kind of sclerotherapy or leg vein 101. Leg veins can be a health issue. We'll point out to you if you come in for a skin check and I think you have an issue. But if you have a few areas or whole legs of leg veins, now is the season to come in and get those treated so that you can spend the winter covered up, letting the bruising heal, letting the pigment heal that can happen after, so you'll be ready for springtime. Hope you enjoyed our session on leg veins. I look forward to any questions that we can answer or dig in deeper with you.